these reports are hitting doctors' desks today, and they have to be able to read them. And more importantly, they need to be able to interpret them for themselves to make the best treatment choices, and then also to explain it to the person that they're attached to. And obviously, patients need this information explained to them, and it's really complicated. It is like looking at a hieroglyphic, and that has really changed things. The flip side of it is, very often these genetic aberrations, oncogenes they're called, at least in cancer, they're so potent that if you treat them, people just get better. Probably the best example is chronic myelogenous leukemia and the drug Gleevec. This pill, replaces bone marrow transplantation for patients. Pill or bone marrow transplantation. I mean, that's how radical the change is. So in many ways, it's a lot easier. It's just a doctor writes a script rather than arranges for a bone marrow transplantation. But usually, these genetic pieces of genetic information have to be factored into the whole care of the patient, their history, and all the other factors that govern their health. So it's another thing that doctors have to learn about. But that said, it's usually very potent and very helpful in putting the whole case together. So, long answer to your question, it makes your job a lot easier sometimes and a lot harder sometimes. Also, not all of these changes, there's a clear path as to what's the right thing to do. There's a lot to being a doctor, but this does change things, but for the better.